What's going on? If you clicked on this video, it's because you are either struggling with or would like to learn more about pain that occurs on the inside of your knee. If you are looking for pain that occurs right in the middle of your knee, right on the outside of your knee, those will be in separate videos. My name is Dan Genader. I am a doctor of physical therapy in what I consider to be the nicest physical therapy clinic in all of Manhattan. And here in this wonderful practice, I see a lot of knee pain. I work with a lot of dancers. I work with a lot of athletes, runners, everyday recreational folks. So knee pain is something that I see and treat on a daily basis. In this video, I'm going to talk about the two most common causes of pain on the inside of the knee that can be easily treated or easily worked with. If you get all the way to the end of this video and you feel like your pain that occurs on the inside of your knee hasn't really been discussed or hasn't really been covered, there might be a chance that what you're dealing with is a little bit more complicated and you may need to go see somebody in person. But since the causes I'm going over today are very common, hopefully that is what you're dealing with, and with just 2 to 4 weeks of exercise, you can get to feeling significantly better. So without further ado, let's get right into it. The two main causes I'm going to go over today are a small tear in your medial meniscus or something muscular that is occurring that is causing pain on the inside of your knee. For both issues, we're going to talk about how you can immediately see a reduction in pain, build flexibility, build strength, and rebuild control so that hopefully you can get that knee feeling good and staying that way. Starting with your medial meniscus, in your knee, you have a meniscus on each side that separates your femur from your tibia. They can be thought of as nice little cushions so that your bones don't run into each other. But because of their positioning and because of their job, it is not uncommon to experience a small tear in one side or the other. And if you feel pain on the inside of your knee, we're talking about your medial meniscus. If you have something going on with your meniscus, you will likely see a few different symptoms. The most common symptom will be a click that happens on the inside of your knee every time your joint passes the same range of motion. In your knee, there can be a lot of clicks or sounds or pops or things like that, but this one is different because this one oftentimes is uncomfortable, if not painful. It's also pretty common that when you do feel that click take place, you might feel that knee get stuck a little bit and you almost have to kind of like get past that point to get back into a range of motion that feels like it's moving well. Along with that, wherever you feel that pain on the inside of your knee, it is also common to feel an increase in pain when you fully bend that knee, along with when you fully straighten that knee. It'll almost feel like there's quite a bit of pressure on the inside of your knee, and that pressure can get pretty uncomfortable whenever you take it into both directions. The third symptom is that it will feel incredibly uncomfortable and you will be very uneasy when trying to stand on one leg and twist. Because that meniscus helps to resist a twisting force inside of the knee, if you feel uneasy when you twist or you feel like when you do twist your knee wants to buckle, you may have a compromised medial meniscus. Now that we've talked about what a meniscus tear might look like, let's talk about what you can start to do with it. And you're going to get started with one very simple exercise. That exercise is called a heel slide, and you're going to start by bending your knee up as far as it will go just until you start to feel a little bit of that pressure. Now, as we just discussed, I know that this is going to start to feel uncomfortable, but the key is to see if that discomfort starts to get better the more that you do. After you feel a little bit of that pressure, you're going to hold about a second, and then you're going to straighten your knee out as far as you can. And same thing, you're looking to feel a little bit of that pressure, a little bit of that discomfort. After holding about a second, you're just going to continue to go back and forth, and you're going to do this about 15 to 20 times. If this exercise is working for you after doing about 15 to 20 of them, it should feel significantly better than when you started. The theory is that the more you take your knee through end ranges of motion, the more you get that meniscus to flatten out and give it the opportunity to heal. When a meniscus is torn, oftentimes it can kind of like fray and get stuck up, and that's what you feel when you feel that click or you feel that roughage or you feel something not moving correctly in your knee. So if you keep that knee in a controlled environment and you take it all the way bent and all the way flat, then you can start to really kind of get that meniscus in a spot where A, the knee moves better, and B, it can finally start to scar over. And honestly, when it comes to a meniscus tear, that is really the main thing that you're looking to add. And then once things start feeling better, you can start to progress into exercises. I'm going to save all the exercises for the end of this video because they're really the same for either issue. So if you want, go ahead and skip ahead to where I get to the exercises. And if you're still here because you don't feel like you're dealing with meniscus pain, well, good news is I'm about to go over the second most common cause, which is something muscular. A muscular issue that is leading to pain on the inside of your knee is most likely occurring at what is called the pes anserine or the goose's foot. It is this spot that lies on your shin bone right here on the inside of your knee, and it's called the goose's foot because 3 main tendons attach there. So when you look at it kind of on an anatomical scale, it looks like a goose's foot right here. The 3 muscles that make up your goose's foot are your semitendinosus, which is an inside inside hamstring muscle, your gracilis, which is a muscle in your groin or one of your adductors, and your sartorius, which is a muscle, actually the longest muscle in your body, that runs from the inside of your knee all the way up to your hip. While any of these could be the culprit, the two main culprits are your hamstring and your groin. To see which one is giving you issue, you're just going to take your hands and feel through that muscle and see if it feels tight, tender, or angry when you try to get at it. To reach that hamstring muscle, you're going to kind of just come to the back of your knee and work your way up just about an inch or two and kind of feel deep into that muscle. Really try to take that claw and get in after it. If you do that and you feel a tear come to your eye because it is so unpleasant, there's a good chance that that's a good place to start. For your adductor muscle, you're going to kind of take that same bear claw technique and you're going to find about halfway up the inside of your thigh. It should be right about here where you might feel like that muscle is tight and angry, and you might have to dig around for a little bit. But once you find it, you'll know. To start to take away symptoms, you can use one of my two favorite tools, either a stick roller or a massage gun. So, keeping this leg nice and relaxed, you can take your stick roller, find that spot on the inside of your hamstring, and just start to work it like this. You want to use a pressure where you might feel kind of like that good hurt type of sensation. It's certainly uncomfortable, but intuitively you know that you're doing some good. The goal is to go for maybe 3 to 5 minutes, and by the time you're done, it should feel better than when you started. If you ever finish with one of these tools and it feels sore or bruised or anything of that sort afterwards, you were probably just pushing a little too hard or you went a little too long. To target that groin muscle, you can do the same thing, but obviously a little higher up, a little further on like the inside of that thigh, and then kind of changing the hand orientation a little bit as well. If you're more of a massage gun person, you can just do the same spots, getting it right in here to target that hamstring, or getting it right in here to kind of target that groin muscle. Next, we're going to start to build some flexibility through those two muscle groups. For the hamstring, you're going to do that lying on your back, holding behind your leg, and keeping your toe pointed towards your face. Maintaining this position, all you're going to do is slowly straighten out your knee until you start to feel a big stretch in that hamstring. Once you feel that, you're going to hold about a second and bend it back down, and you're going to go ahead and repeat this for 2 sets of 15. The goal is that you stop yourself at a gentle stretch so that each one feels better than the last, and then by the time you're done, you feel like you've really increased a lot of the flexibility that you have in your hamstring. If you find that that really helps your symptoms and helps your pain, you're going to go ahead and repeat that 2 sets of 15 multiple times a day. To increase flexibility in the groin, you're going to do a simple groin stretch, which just involves having your feet a little bit wider than shoulder width apart and just tilting your pelvis to the side until you start to feel a nice big stretch right there in the groin. You're also going to want to keep this stretch nice and gentle, hold about 15-20 seconds and repeat 3 times. Same thing, if you notice that this makes a big difference in how your leg feels, how your knee feels, you can go ahead and repeat this multiple times per day. And finally, now that we've talked about reducing symptoms and improving flexibility, it's time to talk about strengthening exercises. When it comes to giving exercises for people struggling with knee pain, I almost always prescribe single leg exercises. If you are suffering with an injury like this, there's a good chance that one leg is significantly stronger than the other leg. And the only way to truly find that out is to do exercises separately, one leg at a time, and find out where you start to fatigue. Oftentimes, for instance, if you're doing 1 set of 10 on each leg, the side that doesn't feel any pain, you'll be able to do 10 repetitions no problem. But the side where you feel the pain, you might start to feel really fatigued or really tired after about 6 or 7 repetitions. That's a good sign that you have to improve strength in that leg to really make a lasting difference in how that knee feels. To finish this video, I'm going to show you 3 easy exercises, 3 moderate exercises, and 3 more difficult exercises. Depending on where you feel like you are at physically, you can start with one of those 3 levels and then build from there. The 3 easy exercises are going to be done all laying on your back. The first one will be a straight leg raise, where the goal is to keep your knee as straight as you can keep it, your toe pointed towards your face, and then using your core and using your hip flexor to just lift your leg up off the table. At the end of the day, this should feel like more of an activation exercise, but if you start to feel like you're really fatiguing, it's also a good exercise to really start to work that hip flexor. Next is a single leg bridge, where you're just going to keep one leg off the table or off the floor or off wherever you're doing this exercise by about a few inches, and you're going to focus on pushing through the heel of the leg that's on the ground. Pushing through the heel, you want to feel like you're using your glute, and you're going to lift your hips up, ideally without any kind of like twisting or compensating one way or another. And then you're just going to try to keep it nice and controlled as you bring your hips to the ground and back up. The final easy exercise is done laying on your side, where you keep your bottom leg bent and your top leg straight. Keeping your hips straight up to the ceiling, you're just gonna raise it up about as far as you feel like you can control and back down. With all 3 of these exercises, your goal is to build up to about 3 sets of 15, where both sides feel about the same and feel just as strong as one another, and without irritating any of your symptoms. The 3 moderate exercises are all gonna be done standing, but with no weights, and then this is gonna start to integrate a lot of that balance. The first exercise is very similar to the one we just finished with, where you're gonna be standing on one leg, trying to keep your pelvis nice and even, keeping this leg that's off the ground straight, and then raising it up to the side. The goal is that you can make this movement while keeping the pelvis even without shifting one way or another. And with this one, you're gonna try to build up to the point to where you can do 3 sets of 12. The next exercise is a simple reverse lunge, where you're gonna try to keep all of your weight on your heel, keep your knee over your ankle, and take your back leg out of the way, and pushing through the heel, come back up. If you feel like you need to hold on to something while getting used to this exercise, that is totally fine. Just make sure you're not relying on that to help yourself back up. You're only relying on it for a little bit of balance. For this one, you can go ahead and shoot for maybe 3 sets of 8. The last exercise is kind of like a step down, where up nice and tall with your pelvis nice and even, all you're doing is bringing this knee forward about as far as you can, as far as you can comfortably control, and bringing it back. This one can be the toughest exercise because it puts the most pressure through the knee, so only go to the point to where you feel like it's comfortable and then come back up. Go ahead and also repeat that one for 3 sets of 8. For the 3 tough exercises, you're basically gonna do all 3 of the moderate exercises. You're just gonna add a little bit of resistance. For the first exercise, you're gonna hold it right close to your chest, do the same thing, and what's gonna happen is you're gonna feel your core kick on a lot more, and you're gonna feel a little bit more fatigue as you're going through the range of motion. For the lunges, you're gonna hold it in the opposite arm of whatever leg is doing the work, and same thing, you're making that nice good lunge. For the step down variation, you're gonna hold it where you're holding it for that first exercise, coming down as far as you can control, and back up. And you're gonna repeat for all the same reps and sets. And if you follow everything that I have outlined in this video, in 2 to 4 weeks, you should hopefully be feeling significantly better, or like you're moving in the right direction. But that's all I've got for you today. So if you enjoyed this video, please please subscribe. It truly does make a big difference. And if there's any videos that you'd like to see moving forward in the future, please go ahead and leave those in the comments.